Hi, I'm Alexis Kenny. I am your aesthetics nurse provider at Classy Contouring. And today's quick video is just showing all of our clients that have had post-operative care, what they can do at home as far as lymphatic drainage goes. So I have a couple tools that I want to show you guys, but before I do that, I want to show you the very simple tools that you have attached to you, which are your hands, your fingers, and we're going to start with those first, and we're going to touch certain key points over the body, mainly the lymphatic channels. Think of the gate openers to the system, and we're going to stimulate those and hopefully open up anything that's clogged. So whenever you're starting this, you want to start here in the main trunk section of your neck. You have your upper part of organs and vital organs here, you have your trunk, and then you have your secondary vital organs there. And so a lot of people want to, when they think of massage, they think of working distally and then proximal. And with lymphatic drainage, it's reversed. So we want to work proximal first to open up the major lymphatic channels, and then we move distally. So go ahead and do this. Take your hands right there, and you have your clavicle bones here or your collarbones. You could use that as a marker, and you have a series or a pearl necklace of lymphatic nodes above your collarbone as well as underneath, and we're going to start with underneath. So what I want you to do is I want you to take your fingers, and I just want you to palpate or touch or pulsate the lymphatic nodes underneath the collarbone. And it's very gentle, it's absolutely very gentle. And once you're done with that, we move above, and then you're gonna stimulate those ones up at the top as well. And then from there, you're gonna move to your neck, and you're gonna move behind your ear, in front of your ear, and just stimulate. You also have what's called a thymus here, right here, underneath your breastplate, and I want you to stimulate that by tapping. So we'll tap, tap, tap. And for the sake of the video, I am moving pretty fast. So you want to take your time and do a full body within 5 to 10 minutes. After that, you're going to go to the lymph nodes underneath, basically where your underarms are at, where the breast starts. As females, breast tissue, we have a lot of lymphatic nodes here as well. So we'll want to stimulate those, and you want to go ahead and kind of move those around here. You also want to tap as well on both sides. From there, we're going to move to the stomach. You can take both hands here, and you can do some rubbing to stimulate stuff. You should be doing these exercises at least one time a day. So I would like you to perform these before your shower. After the rubbing, you can go into pressing. You can go together, you can go opposites from one another, and then from that, we're going to do tapping, right? We're going to do tapping. I want to tap those. And then from there, we want to go into behind our knees, and same thing, we're going to just tap, we're going to massage and manipulate, okay? After after you've completed all those major areas that we've discussed, I want you to just go ahead and lightly bounce up and down on your heels about 20 times. And that's gonna really start pushing distal fluid up towards the heart. The first tool that I'm gonna talk to you about is dry brushing. Most people have heard of dry brushing, they're familiar with it. You can get a simple dry brush on Amazon. And what I want you to do after you've opened up the channels is I want you to take your dry brush, and I want you to start brushing, just very lightly, right? Very lightly start brushing. And what you're doing is we're moving all of that fluid towards the heart, right? And you're gonna do that to all of your limbs. And then if you've had liposuction, mommy makeover, tummy tuck, BBL, we want to also brush those areas as well. So with the stomach, you wanna do strokes going to the heart. Same thing with the major lymphatic channels here. After you've opened those and stimulated those, excellent dry brushing. We want to brush up, brush up, brush up. And this will help with also decreasing cellulite, because a lot of the cellulite is just fluid that's trapped between the space. So after you've brushed your whole body, you should feel like a light pulsating or a light tingling, things like that. The last thing is we want to take a hand towel. This is a little big, but for the purpose of the video, to make this short, this is what I had, so we're going to use that. When you're in the shower, you've been in there for 5 minutes, you've let the hot water stimulate the system, also helps with lymphatic drainage. You want to take your sponge. You don't have to put any soap on it. You can do it, you can wash your body, and then you can use it after. But I just want you to kind of do the same thing. This is very different from dry brushing just because of the surface area. The surface area is stimulating that. And same thing, I want you to stimulate those areas in here and do some nice rubbing. Same thing on this side over here. If you're in a bath, because you're past your post-operative phase, everything is closed, your wounds are completely healed, then you can submerge yourself into a bathtub. I want you to do gentle rolls around your lipoed areas. With tummy tuck, in the shower, I don't want you to do this yet. But same thing, we're just gonna go around and we are going to stimulate the area. We're also gonna move towards our back like this, and it might feel weird to you, it might feel good to you, nothing should be painful. So those are the tools that I have. Those are my tips and my recommendations for you, for any of my post-operative patients, as well as anybody who's non-operative. So if you are non-surgical, you can absolutely do these techniques every day as well. It helps open your lymphatic system, it helps relax you, de-stress you, and most importantly, remove the fluid and remove the toxin out of the body. Everything travels back to the heart, to the liver, and out of the body. So I hope that this has been helpful to you.